Hello, so my name's Claire Bynner. I work for What Works Scotland, and I'm a research associate based at the University of Glasgow. So in this presentation, what I'm aiming to do is to cover four main areas. First, I want to talk about What Works Scotland and the Scottish approach to public service reform. Then we're going to look at four rationales for place-based approaches. And then we're going to discuss community planning partnerships and their use of data at a local level. And finally, I'm going to share some thoughts, reflections on some of the challenges and opportunities for place-based approaches in tackling inequalities. Okay, so What Works Scotland is a three-year project. It started in 2014. We're split over 2 universities. And really our remit is to support and enhance the potential for public services to address some of the challenges that we're faced with around public service reform. So we're working at a national level with 9 different improvement agencies. And at a local level, we're working more intensively with these 4 community planning partnerships. So our method at a local level, working with the community planning partnerships, combines collaborative action research, capacity building, and a focus on how evidence can be turned into action in practice. So we're situated within the context of dramatic challenges across, well, internationally. So we're faced with reductions to public sector funding across all post-industrial societies. We're faced with technological changes, globalization, migration, a whole series and host of challenges that mean that across all countries are having to respond in some way by changing their public services. So we're situated following the Commission on the Future of Public Services, which is known as the Christie Commission. The Scottish Government highlighted 4 pillars for public service reform, sometimes referred to as the 4 Ps. That's prevention, which is similar to early intervention, performance, participation, and partnership. So the Scottish approach to public service reform also is characterised by a focus on asset-based approaches, this notion of co-production in the design of services, and partnership and prevention. But crucially, I'd add to the 4 pillars of Christie an additional 5th P, and that's the focus in Scotland on place. Unlike England, in Scotland, we have this framing of our policy that place is seen as a magnet for partnership working and a focus for community participation. And that's key to understanding the Scottish approach. So why this focus on place? Now, if any of those who remember the Goon Show, I thought this was a rather insightful little quote from Eccles. Since everyone's got to be somewhere, everyone is in place. Everyone, all of us, have a relationship to place. It therefore follows that it's a very useful concept for policymakers because you can more or less attach more or less any intervention or program to the notion of place. And that can present its own challenges. So if we do a quick review of Scottish policy and try and identify what are the drivers, the rationales for a place-based approach, there are 4 key rationales, I would argue, driving place. The first is the civic rationale. Now, this is the notion that people identify with local places, particularly low-income communities, that they are motivated by where they live. And there's the policy agenda here is about animating local people, mobilizing individuals into action, mobilizing assets, both relationships, networks, buildings. And this policy is expressed in England in the form of the Localism Act, And in Scotland, it's really embodied in the Community Empowerment Act. The next rationale for place is the age-old challenge of coordinating public services. So the idea that if we could only get all these various services at a local level to work more effectively together, we would have some responses to the challenges that we face. Yeah, it's a challenging one, and it's probably one that we'll be working on forever, I think. The political rationale, this is a really critical rationale. Now, the Commission for Strengthening Local Democracy highlighted that Scotland has one of the worst ratios of elected members at a local level to citizens. So if you look at our ratio, one councillor is to represent 4,270 individuals. You compare that to Finland, where one local elected member would represent 500 people. So effectively, what place-based approaches are trying to do is to fill this void in local democracy. And finally, the economic rationale, and of course there's got to be the economic rationale, which is that place-based approaches are a way, we think, perhaps to improve efficiency, to be more effective in joining up public services, but also looking at more personalized services, intervening earlier in a chain of outcomes to offset the negative cycle of negative outcomes in the red. So this diagram from Dundee Community Planning Partnership demonstrates the need to try and stay on the green side in a cycle of positive outcomes, and that's also an economic rationale for a place-based approach. So for many of you here are very well aware that place-based approaches are nothing new. The Institute of Government had a look back to the start of New Labour, 1997. They found 59 different national programmes around place. And the picture in Scotland would be very similar. In fact, I'd argue you could trace it further back. You could go back to the 1960s. You could go back to the community development projects. And you would see place-based approaches have a long history. So in Scotland, the key structure for place-based approaches is community planning, established in 2003. Now, they haven't the best track record for reducing inequalities. There have been some successes around reducing knife crime in Glasgow and some signs of some positive indicators in Glasgow. But overall, they haven't had the radical effect that perhaps we'd hoped for. Nevertheless, they continue to be given a pivotal role, and there are very ambitious expectations for them. Added to that, the Community Empowerment Act further strengthens the role of community planning partnerships, and it's been described as a potential game changer for achieving that transformational change. So how is local data being used by CPPs? So what we know is that in three main ways, CPPs tend to use the local data, the data that you may be involved in producing. They use it sometimes often they use it to identify their most deprived neighbourhoods and to target resources towards those neighbourhoods. They also have used it to focus on a smaller number of priorities. So the single outcome agreements could be a list of a vast array of priorities which community planning partnerships were trying to achieve. The use of data has helped them to define their priorities more tightly. And the last way in which data is used is to help, particularly at the moment, is around developing local outcome improvement plans. So, looking at the example of Western Bartonshire, we've, at What Works Scotland, been working in Western Bartonshire, and little background to this area. It's the 10th smallest in terms of population of any of the local authorities in Scotland, and it's the second smallest in terms of its land mass. It shares many of the similar challenges to its neighbour, Glasgow. So many of the socio-economic inequalities you find in Glasgow, you also find in Western Bartonshire. The concentration of population density is around the Clyde Bank and Dumbarton, with beyond Dumbarton there's a more rural hinterland. Again, high levels of welfare claimants in Western Berkshire. I was just looking at the Scotfo profile, some really interesting data there, showing 20% higher levels of mental health issues for individuals in Western Berkshire. So we were asked by the local community planning partnership to come and help them with their place-based approach. And what they were looking for was data at a local level on a range of indicators. And they didn't have the skills within the partnership to produce this data. So we set up a partnership project with Glasgow Centre for Population Health, NHS, NSS, ISD, and we compiled 17 neighbourhood profiles at the level of community council areas. And these profiles cover population, culture, environment, health, education, housing, a whole range of different indicators. We produced them both as an interactive mapping tool available on your mobile or on your laptop, and also as downloadable PDFs. So we had, in doing this project, we started to look at how data was being used and the capacity of local practitioners to use data. And we compared that experience to another community planning partnership, Fife. So comparing these two partnerships and their capacity to work with data was quite striking. Firstly, we know when we look at this, the SIMD data that these negative outcomes are clustered and highly localized. So we know that getting that level of microscopic, down to streets and up to other scales, it's very important to be able to work flexibly with that data to understand the nature of inequalities. Now, in Western Bartonshire, until we worked with them, they had no means of doing that. They had no means of actually extrapolating that data and analysing it. On the other hand, Fife, since 2007, had been working very flexibly with data, integrating social justice and analysis very effectively. But we are talking about different scales of work. Western Berkshire only have 17 community councils, whereas Fife are working with 104. The other issue and challenge is that the alignment of partnerships can be different. So in Western Berkshire, there is no alignment between the locality working of the Health and Social Care Partnership and the CPP. On the other hand, in Fife, they have that alignment. One member of staff was sort of allocated towards data work in Western Bartonshire. Fife have a research team, 11 people strong, working both on statistical data and integrating local data. And they're very keen on it not being all about statistical data. So this gives you an example of the differences between different contexts. So bringing us to some challenges. Contextual factors. When you're looking at CPPs, they're widely different, these contexts for working, widely different starting points for partnership working, and histories of relationships in local areas. When you look at the actual resource to work with evidence and to work with research, widely divergent resources and staff capacity. Issues of partnership alignment can also be challenging when you're talking about local geographies. And we also have a challenge that I don't think is talked enough about, which is that there are an awful lot of agencies on national level seeking to work with community planning partnerships. But there's an issue around the time it takes to negotiate the different types of support on offer, and finding a fit to the programs and projects that community planning partnerships are already committed to. And that can take a considerable amount of staff time and be a significant impact on a small team. Opportunities and some risks. So the Community Empowerment Act, it presents some opportunities, definitely. The locality planning requires an in-depth understanding of local places. Actually, the more important opportunity from the Community Empowerment Act is that it has an explicit emphasis on tackling inequalities, and we really need to focus on that. But also the emphasis on locality working and having a more in-depth understanding of places provides an opportunity to bring research and data into play. The improvement agenda, I think, also offers us an opportunity to focus more on context, practices, and the behaviours of practitioners, and to actually realise that they have a vast wealth of local knowledge, experience, expertise, and they have aspirations at a local level to do excellent work around poverty. And, you know, we need to realise that potential. We're also hoping that What Works Scotland, that our new project called Making Data Meaningful, will be a project that will provide some insights into some of these challenges. That project is looking in practice at how practitioners understand evidence and how they work with evidence and how and when they find data and evidence useful to make some transformative decisions and changes. But I do have a word of warning or a word of caution around place-based approaches. The evidence for their impact in terms of life outcomes is not robust. It's fairly weak. We don't have a lot of evidence to show that the types of issues Denise is talking about are likely to be tackled that easily by place-based approaches. So there's a risk of overstating the potential. Nevertheless, I think we should recognise as well that it's not all about outcomes, and processes of participation can be of value in themselves. The other caution I would add is that there is an enormous risk of overload with the current policy agenda. There's a real pressure for reform and radical change, but with that pressure is the potential for overload at a local level. And because places everywhere, as we discussed earlier, there's also a risk that those communities that are mobilised already and are most ready to take these opportunities that the Community Empowerment Act will bring, that they take precedent and we lose focus on the really important and unequal spatial effects of public service cuts and welfare reform. So finally, I'd say that place-based approaches are not a silver bullet, but they can have some contribution to make. They do have a potential to make an important contribution, but I think we need to focus in a much more responsive way to the needs of practitioners on the ground working in community planning partnerships. Thank you very much.